miss the point of having a voice. When you get ready to go to that provider, know what it is that you want to talk to them about. Write down your questions. Think about how you feel and how you can relay that to the person. Because sometimes we miss the mark just by not being able to describe what's going on. And I know sometimes it's not possible to describe it. There's been times when I've been in pain or not feeling well and I couldn't pinpoint what was wrong.
Right.
But the times that I can just keep in a journal or whatever it is, especially if it's a chronic illness, of the things that are going on, so that you can communicate those things, because those are important pieces to being treated by a provider. As far as having a voice, you have to insist that they give you the time that you need to relay how you're feeling or what you need from them.
Now, see, so you have to insist.
The most important piece is when you are choosing a provider, that you do a mini interview, that you make sure that that individual is a good fit for you.
Right.
You know, that they're not going to rush you in and out and treat you, you know, like a number or like an insurance payment in order for you to get the care that you need. And a lot of times we don't do that. We don't stop them. And like I told you so many times, just dealing with my sisters who have chronic illness. And I told you my older sister said, you know, it's sad that we go to these doctors and pay them this money and then we come home and we call you. I said, stop.
Wow.
Stop them.
That is a heavy.
When you leave the room, you say, listen, I haven't been heard. I'm not leaving with what I came here for. Stop them.
That's right, Danielle.
And if they don't give you that time, then you need to find somebody else.
That's right. That's absolutely right. Because it's the same, like we say always, that restaurant example of healthcare. You know, I think that what patients need to understand, along with the fact that they're a patient, is that they're a customer. They are a customer in a retail
Tiffany,
experience.
If you're trying to say something, you're on mute.
Oh. How did I get on mute?
Good evening, Sandra.
Hi, Sandra. Wait a minute. I'm on mute. How in the heck? Oh, sorry about that. I had no idea why I was on mute. I was just talking about I think that we, in order to be stronger patients in healthcare, especially women, in order to be heard, in order to be valued and understood, that we have to know our things coming in too. You know, I feel it's extremely important that women have education about their health, their unique needs, and their providers, the places they go to get health care. You have to know about these things because they're always talking about scores and, you know, we do the best in stroke while we do the best in orthopedics. I don't want to go to the best orthopedic hospital to treat my stroke then. These are things that women, you know, have to know in advance in order to deal with their care and treatment properly. But as far as the retail experience, my goal is to show women that not only can you use your patient rights and responsibilities in your healthcare, but you can also use your consumer rights. And I'll give an example. Say you go to a doctor and the entire appointment was crappy. They spoke down to you. They rushed you. You couldn't ask all the questions. And say you got this really horrendous diagnosis, any chronic illness diagnosis. The only thing you hear is that diagnosis first. And then most patients, even myself as an advocate, I'm gone. I'm not hearing anything else but the name of that disease. If you have a doctor that treats you negatively regularly, then yes, you have to leave. That's why they're not the only game in town. That's why there's not one cardiologist, not one endocrinologist, not one sleep doctor. There are more than one, because what needs to be understood as well from patients is that your healthcare journey is not just a retail experience. It's an experience that while you're vulnerable, you have to still manage the business end of it. You have to know how your insurance is going to cover your diagnosis. Say you walk into a doctor's office and God forbid they give a cancer diagnosis. Where will you begin? Most patients will be knocked down by the cancer diagnosis. And then after that, they're not hearing anything else. Nothing. My goal is to get patients to use their patient and consumer rights and know what they need to do and how they need to do it when on their healthcare journey to maximize their patient outcomes. That's the whole point for me. But I've spoken to a lot of doctors lately and gotten a different point of view. And what I hear from doctors, the way they learn, I guess, in medical school is part of it. But if you're not saying something that registers with them, they may just go off. Not go off angrily, might just drift off. They may not hear you anymore. So how is it that we ensure that we are heard and that we are valued in our care? Feel free to jump in. This is one of those things. Just jump in.
Well, I know, like you were saying, a serious diagnosis. I think it's important to establish a good relationship with your provider. Hopefully, before you get that type of diagnosis, you understand how to communicate with that provider, and they understand how to communicate with you and what your needs are before that point. But like I was previously saying, sometimes we have to stop the person because we're all guilty of thinking about something else, or being sidetracked in the middle of something, or too busy doing what we're in there to do. I'm in there to take care of this patient, and maybe and I hate to say it like this, but using a checklist, kind of. Mm-hmm. Okay, I need to go over this. I need to check this off. I need to do this. I need to do this. And sometimes we can miss what that individual is saying, but that individual has to be able to say, I need to stop you right there. I need this information. This is what I need from you. It's important to understand that lingo versus the medical lingo. Just as a person, this is what I need from you right now. And I can hold off on the other stuff because the other stuff is not important to me at that time.
Right.
What I need is important to me. So whether as a provider, whether I think it's important or not, it's the person who has to tell me what, their need is. Because of course, I have a general understanding, but each person is an individual. And I need to understand what that person needs from me at that time.
Right.
And so we have to teach women how to voice that. So we get hung up on the medical lingo. No, I'm a person and this is what I need from you.
Absolutely. And in a customer/retail experience, I find that's easier because my money's involved. Now with healthcare, it is too, but healthcare seems to me more disguised as service, which it is. It's basically a very private, intimate service. You are going in there for your most vulnerable conditions, symptoms, feelings, all of it. And I really think it's hard enough to do that. And then to make providers understand where you are is difficult. And please let me preface, this talk with, all providers are not bad. All providers will not speak down to you. I happen to have a great group of doctors. I really do. But I work as a partner with them, because I am the expert on me. They are not. They will see me 15 minutes every 3 months, every 6 months. That's not enough for me to relay everything that I'm dealing with, going through every day, the pain or, whatever condition I'm dealing with. And that, myself as an advocate, I have forgotten things to ask or go, or talk to my doctor about. I don't think I really want people to understand that it's not about perfection, and you can still make mistakes in your advocacy. For self, I do. But if you understand the importance of the type of communication you have, and educating yourself and finding out everything that's going on with your insurance, I think if we can lay that down as a foundation for women, then we can at least get started with trying to change this dysfunctional system. That's what I think. I jump in again, Danielle, when you feel like it, because
I just want to stop you real quick, because like you said, you have 15 minutes here and there to see these providers, and that's why it's so important that as a patient, we know what we need at that time, because it's not going to be an hour-long session. We need to say, and if you need more appointments, you need to say that. It can be more often than, every 3 months or whatever. You need to say, but this is what I need to focus on today. Maybe my blood sugars are, out of whack. I need to understand this. And then, let me give you an idea. In my next appointment, which I'm going to make an appointment in 2 weeks, I need to talk about my blood pressures.
Right.
Things like that. You need to break it down so that it's easier for the provider and the patient to focus on the issue at hand.
Absolutely. Absolutely. I agree 150%. My goal too, in empowering women to get better care from a system that doesn't listen to us, is to make sure that they're organized, all their personal information, all their healthcare information, all of their complete medical history, all of their insurance information is somewhere where they can access it easily, even in an emergency. We have to keep the lines of communication open with providers too, keeping them up on what's happening with us. When I go back for my 3 months, 6 months, I write down the things that we need to go over before I go. And I don't care if it takes me a week to write down all those things. Oh, I'll remember this here and I'll remember this there. Just get it down so that when in fact, I made a form that women can fill out before their appointment so they can maximize that 10, 15 minutes that they have. They have to go over everything and understand it.
I agree totally with that, and I am a provider, and even when I go see my provider, I don't wait until the week before. I'm writing things down all along, from the time that I leave her office until the time that I see her again. If something happens, I write it down, because I might want to talk to her about that,
right?
But it might not have been consistent, but it was enough concerning for me to write it down.
Absolutely.
I don't think I need to be seen today for this, but I might need to just mention this in my meeting. So I have a little small composition notebook that can fit in my pocket. I write things down because, like you said, in the normal day-to-day, we forget things. So it is important, and I think that's great that you have a form that individuals can use to keep track of things that they need to discuss with their providers.
Thank you. And it's true. You're right. I think about it kind of compartmentalized, like, okay, now I got this appointment coming up. Let me deal with this. But however it's comfortable for patients, however it's comfortable for any patient, because that's another point that you touched on, Danielle. We are all unique. We are all unique. And, I could have the same diabetes diagnosis as my sister does, and we do. But for her, she needs to take medicine, where mine is controlled well with diet and exercise. The same disease won't be the same for you or your friend or whatever the case. So you're absolutely right. And you can do it. You can do it as soon as you leave your last doctor's appointment, because that's going to be the time where you're going to say, oh my goodness, you know what? I forgot about this. I forgot about that. And that could be something you write right for your next appointment. You're absolutely right, Danielle, about that. You're absolutely right about that. That is a key thing to do. Education, I believe, is also key. Again, we as women must research our facilities where we're going. We have to research our conditions and our symptoms and share everything with your doctor. You may think that that pain in your leg isn't related to your back, but oh, yes, it is. So if you speak to your doctor about all of your symptoms, then they're the ones that have the medical expertise to put all of that stuff together. That could be something that we didn't even know about walking in, but now that we have this new symptom, it's related. Same with my back. I have a lot of issues with my back, and I was having pain in my leg, and I'm like, well, I didn't fall, I didn't do anything. What's going on? My doctor said, it's your L4, L5, or L3, L4, whatever lumbar thing is in there, that shoots down my leg into my feet. And I had no clue. I really didn't. I'm not a medical professional. I have worked in healthcare for many years, but I am not a clinician by any standard. So it's a meeting that has to happen between an empowered patient that knows about their conditions, knows what facilities to go to, knows when to get care, and the medical professional who has gone through a whole circus to get that degree and that accreditation. It has to be a marriage of both if we're going to get any further or better in our care. So if anyone wants to jump and speak in, Mary, welcome. You can speak now if you'd like.
I'll be on in just a second, okay?
Okay, sure.
I'm about to say some things. All right, thanks.
So I really, and Mary is new. I just met her the other day on Dr. Nicole Rochester's Clubhouse room. And she is another provider with great insight, like Danielle, into, the other side of healthcare, because I've worked in the system as a non-clinician, but they work in the system as clinicians and understand the quotas, the work, the administrative part of it, which I don't agree that providers should have to do all the time. Hire people to do it. Because the more that provider's focused on patient care, the better the outcomes will be. So I think that, education is extremely important. I think understanding healthcare as a retail experience is extremely important. And Danielle, you had some great tips about, talking to your doctor and what else needs to be said if you don't have everything. Hello, I need a little more, even if they're trying to walk out the door. That's where, patients have to speak up and basically demand care that they deserve and pay for. That's my thought with it. And I want women to become more empowered, because we are the majority of caregivers. We make the majority of buying decisions. We make the most healthcare decisions. So I can't understand that why the system is set up not to hear women when we talk. As many unique needs as we have, even with female reproductive care and, breast care and all these different things. I don't think that our healthcare system is meeting the mark when it comes to our needs, but I don't think that's on necessarily a provider's behalf. I think it's just the way that our system is set up. Anybody want to jump in?
Okay, yeah, this is Mary. So I want to clarify, I'm not a provider, I'm a patient.
Oh, I'm sorry, Mary. I thought you were a doctor too. I'm sorry about that.
No. Oh my gosh, no. I don't even have a degree. So I mean, that's nice of you, but no, absolutely not. With the way I've been eating, I sure to hell am not a doctor.
Me either.
Oh my God, doctors do not eat carne asada nachos. So there you go. And if they do, they sure to hell don't tell me about it. So if they don't tell patients, no.
That is funny.
That's kind of you, but nope, I'm a patient. And the reason why I came on to Dr. Nicole and everybody's room is because I'm a patient, and because I felt as a patient, we need to be heard. Because no, like the medical field does not listen to us. I'm sorry, like very few people do. I mean, I'm lucky to have the people I have because they're very special people, but I've been to providers where they don't listen, and there are providers that gave me pushback when I said in Dr. Nicole's room that we as patients have the right to choose, and that yes, there are recommendations, and I understand they're board certified recommendations, but we have the right to choose to say no. And I got pushback from a couple of providers.
Wow.
And okay, yeah.
Tell me a little about that pushback.
Well, they said, we're board certified. We've been through decades of schooling, yeah, and they're right. But we also, as patients, know our body, and if we don't react well to something, we have that right to say no. And I kind of felt like there was some pushback, and in a sense, it kind of triggered me. And the reason why it triggered me was because I've been to, in real life, providers that would give me so much pushback that I almost felt like they didn't care about what I was saying. So I had to do my own duty and leave. Arrivederci, case is closed.
We were talking about that earlier, Mary. We were saying that's why there's more than one cardiologist. That's why there's more than one endocrinologist.
Yep.
Because if you're not going to treat me right, I'm not going to continue to, just because I don't put cash in your hand doesn't mean I'm not paying you. I'm paying you through my insurance and through my copays and through all these other different ways. Right. Deductibles, premium, all of it. Yeah. And if you don't give me the care that I feel I deserve, even as a human being or a woman, I'm out of there. Just like any grocery store, just like any restaurant, just like any other retail experience.
Yeah. I want to jump in real quick for a second.
Yeah. Go ahead, Danielle.
As a provider, yes, I have the schooling, and I feel like it's my responsibility to give the patient all of the information that they need for us to make an informed decision together. Because everybody is individual, and Tiffany, I've said this multiple times, I feel like I do my best work when I'm listening to the patient, because they're going to tell you exactly what they need. They might not know the medical terms, or they might not know the exact treatment, but then that's my responsibility to give them that and be able to go over them options. And the other part of it, that's what I mean by you have to develop that relationship with your provider, because I want you to trust that I'm going to give you the correct information. But at the end of the day, it is the patient's decision what the plan is, because it's their plan of care. It's not mine.
Right.
I just wanted to say that.
Right. I think that plans of care, I think a lot of times with healthcare, because providers are the medical expert, and that's great. It has to be a plan of care that patients have input on. It's got to be something like that. I mean, I say this because I know a lot of patients that sit quietly in their appointments, and no, this is your time. This is your access to the professional. Make it so that you maximize. What was it like? Wasn't there a report that said that we're only in the doctor's office maybe 7 to 10 minutes?
7 minutes is the average visit. By the way, you have short clips turned on.
Oh,
is that something you intended, or could you turn them off? Because
I have no clue what that is even.
Can
Okay.
I tell you how to do it, please?
Sure.
I don't like people recording me, and I don't know if, and I know that you guys aren't, but you don't know. Who knows who's
Well,
in the audience?
I will be honest, Mary. I did preface this at the beginning. I am doing a recording on my YouTube, but it's private.
Oh.
Yeah, it's private.
Oh, okay.
Yeah, I like to record these so I can have them and go back over them and, what can I do better, that kind of stuff.
Clubhouse short clips is turned on. Oh, it's okay if you do it on your own time.
Okay.
But Clubhouse short clips is turned on and people can make snippets.
Okay, so
I'm getting sick and tired of Clubhouse. Yeah.
How do I turn that off?
So do you see where there's like a scissors icon in the bottom?
Yes. Oh, okay.
Under room. Yeah. So click on that.
Okay, got it.
It should say short clips on. Just click on that to turn it off.
Okay.
I'm blind, so it's hard to explain it, but I'm trying my best.
You did just fine.
Yay!
You did just fine.
Oh, thank you so. I have written to Clubhouse several times to ask them to please not have it automatically turned on, to ask the people to turn them on themselves, but they apparently not yet listened. So I hope somebody in here in Clubhouse is listening to this room. Thank you.
No problem.
Clubhouse, by the way.
I do too. And you know what? I want people to come into my room feeling that they can express themselves and talk about their healthcare without any kind of, retribution or fear or, feeling like, this won't be private, because it is a very, very sensitive subject. It's very intimate. Yes. It's very vulnerable. It's very, and those characteristics are the things that make it not look like the retail experience that it is. We kind of have, there has to be a marriage somewhere.
I'll be the short clips police. How does that sound? So if ever I'm in here and you have a room open, and if I see that they're turned on, I'll be like, hey, short clips is on. Can you turn them off?
No problem.
And then, of course, it's up to you. You're the room moderator, but
no, I want people to feel secure. I want them to feel, that they can speak. And if that's a if it's a matter of turning the clips off, that's no big deal. No, okay. It's more important for me to have people come in here and be honest and genuine about the things that they've experienced, so we could really get down to it and try to solve problems and issues, because that's the whole point. I want women to walk into their appointments ready to manage whatever comes their way, at least, for the most part, the business part of it, the insurance, the whatever the doctor has to do to make sure they get paid. I keep saying marriage because, and I think that marriage with every patient and provider is different. That must be really tough on providers to have to meet patients where they are all the time, because lots of different patients are in lots of different areas when it comes to this. Is that, true, Danielle? It's hard to meet them. I mean, everybody, as many people as you've seen, to meet them where they are when it comes to maximizing, better outcomes for patients.
I'm going to say that no, it's not difficult, because that's the art to taking care of people. And I just want to say one more thing. When you was talking about the plan of care, when you have a plan of care that does not involve the patient, you run the risk of it not being a plan of care. Because if they're not on board with it, they're not going to follow the things that you're saying anyway. So they have to be involved. It has to be their plan of care. That's just like even with patients with wound care. If I recommend that they elevate their leg and they say I'm not going to do that, then I need to go back to the drawing board and give them other options, because they're not going to do it. So it's not an accurate plan of care. It's not going to help the situation. So there's no such thing as a plan of care that does not involve the patient.
Okay. Thank you for saying that. Because I think a lot of times we don't give input. That's something with patients too. Why do they feel intimidated when they're trying to, get the care they need? Why I don't, that, I guess the white coat syndrome or something like that. I can list reasons. I know for me, if I don't know, then I'm going to be quiet either until I learn or it comes to a point where I have to address it. So I think, patients feel intimidated, but what are some reasons why? Because those are the things that we have to eliminate too. Reasons for feeling intimidated when you're getting the care you need. Can anybody speak to that? Jump on in when you feel ready. All right, we'll keep going. Oh, okay, go ahead, Danielle.
The only thing I can add to that is that it's going to be very individualized because I am a provider and I also have white coat syndrome. Why, I don't know. But every time I would go and see my provider, my blood pressure would be elevated. I leave there and it's back to normal. But part of what me and her did, no, I don't want medication. I just started monitoring my blood pressure. Everything is going to be individualized. So people have to evaluate what their feelings are in order to understand why they feel intimidated. I mean, it could be an education thing. It could be so many reasons. So that's going to be individualized.
Absolutely. You're absolutely right about that. Absolutely. It's going to be different things, it could be social determinants as well, that affect access and affect how you conduct yourself at appointments. There are a lot of things that patients need to deal with outside of the system that actually affect their health and healthcare. So it's different situations because as patients, we are all unique. And I feel like we have to address all of these barriers, whether or not you can access a doctor easily in your area, whether or not you have the transportation to get there, whether or not you can get off work. We have to address many, many different kinds of things that are in the healthcare system that are there, to address us. I mean, to, keep us from getting the care we need. I think it's really important and valuable to look at yourself as a patient first. What keeps you from getting the care you need? Is it intimidation? Is it lack of access to good doctors? Is it, transportation? What different kinds of things are standing in the way of you getting the care that you need? We have to eliminate those barriers so we can experience better care that we deserve and care that we pay for. It's time to be heard in the system.
Amen. Oh my gosh.
It's time.
I mentioned something.
Go ahead, Mary.
I don't want to really interrupt, so tell me if this is not a good time, but you talk about intimidation. That's huge. I cannot tell you how many people in my life, be it doctors, therapists, other people within the healthcare field, it could be behavioral, it could be physical, I don't care what the hell the issue is, in my life that have intimidated me and caused me mental trauma. And I already have PTSD from family and exes and other people who've done really horrible, abusive things to me. So then when you have doctors and therapists and other people who have done the intimidation, whenever I try to bring up a suggestion, who's the doctor? Well, you are. Okay, then. So do you think it's really appropriate for you to be making a suggestion to me or a therapist? Well, Mary, didn't we say that we talked about that a week ago and you didn't listen to me? Now, did you? So patronizing. And so I'm traumatized for life by the abuse that I've been put through, not only by my family as well as my exes, but also by doctors and therapists in the medical field who should be there to serve.
Absolutely.
And I'm very lucky. Yeah, I was going to say on a positive point that I'm lucky now to have the people I have. And as much as I could say shoot spit at Medicare. They've actually, in some ways, have really saved my ass, because if I had Medicaid alone, I would be in the shit show, probably considering ending my life because of how horrible people have treated me.
Oh my God.
Because of Medicare and the better people that I have, I'm not in that boat anymore. I'm in a much more positive boat in a sense, but I'm still healing from a lot of trauma. And so my point is, when it comes to intimidation, it's a huge thing. And with people with disabilities, they really have to be very, very careful and very, very gentle with us, especially people who have trauma. Anyway, I'm done. Just wanted to point that out.
Thank you, Mary. And your points are heard, and I agree with them 3,000%. 3,000%. There is no way that you should be going to a provider that makes you feel other than who you are. You should be there and getting respect, good customer service, and be spoken to in a way that you can receive and take action from it. We have to make these appointments, and that's why I focus on patients and empowering them so much, especially women, yet particularly Black women, because like myself, because we see the worst end of disparities in the entire system. We deal with racial and gender bias when we navigate our healthcare, and not only is it not acceptable, as long as I'm around, we won't have it. We won't have it anymore. And I'm making that statement right now. I am going to assist women in getting a better healthcare experience. We deserve it. We pay for it. And we're human beings that know our bodies, so we can come to the table with things to say, even if that doctor is intimidating you. Now, I understand, it's just like we said 5 minutes ago, patients are unique. You have different patients with different personalities, different ways of communicating, all of that when they go into a healthcare appointment. I myself, I'm loud. I've been that way all my life. I accept it. And the people that love me and are around me accept it too. But my providers also accept it, because I don't yell and scream at them. I try to come to them in a way that's respectful, but you hear everything I'm saying. I don't care if I have to write it down on a Post-it note to remember everything I need to tell that doctor, I will. We cannot rely on our memories, so we have to prepare and write things down. We have to be able to document our appointments as well, because if that doctor did treat you bad, not only can you follow up as a patient, but you can follow up as a consumer. And if you follow up, say, with the state attorney general and say, hey, this doctor, he's not nice. He doesn't, or he or she is not nice. They don't educate me. They don't take care of my condition. You're paying them for that service. If they fail you, they have failed you in a consumer sense as well as a patient. This is going to be the thing that women need to know. Critical information. You must partner your patient rights and responsibilities, those little annoying papers they make you sign and keep. You have to partner your patient rights and responsibilities along with your consumer rights and responsibilities. I will call the state attorney general if I feel that I have been negatively treated in my healthcare. If it comes to a point like that, I will do it, because I'm valuable enough for that. I mean, if they don't put cheese on my cheeseburger, I'm going back through the drive-thru. It's the same thing in your healthcare. It needs to be addressed, or you find new providers. A lot of people may not want to address it with that particular provider. Then go for a new one. Find a provider that will meet your needs. And I teach women how to do that too, along with preparing for appointments and communication with their providers. There is no more of we will sit back and take this. No more. I'm done with it. And I've made this, and I don't want to keep this about me. I want to just let women know that there are things that they can do in healthcare or on their healthcare journey that will make it more comfortable for them, easier for them. I've got a great healthcare team. I suffer with insomnia. I have cervical and lumbar spine pain. I have prediabetes as well. I have a large healthcare team to keep me in line. And some of them are there in a preventive sense because I, as a Black woman, face a higher risk of hypertension, stroke, diabetes. Hey, I'm already here. And, as women, period, we have to know what we have a need for that's more unique. Again, we need mammograms, we need pelvic exams, we need different kinds of things that men don't need. And it's a patriarchal system. So how do we get our needs as women met in a system that doesn't listen? Through education, speaking up, and knowing that you are a consumer along with being a patient. Stand up and speak up for yourself. That's what they're there to listen to, no matter how they act toward you. And if it's too much, as I said, go to another provider. That's why there's more than one. Don't keep paying people that are not doing right by you. That's the bottom line. If you don't get good care, and I mean, when I say good care, I mean customer service. I mean with treatment, with your appointment itself, all of that. That's a part of your healthcare journey. And if you're not getting everything that you deserve, you either speak up or leave. Bottom line, we have to start letting these doctors know through their pockets and their wallets that they need to listen to us because they're not doing it. A lot of providers do not. So once we start hitting them in the pockets, I think that's a language that everybody can understand. Everybody can understand that. Does anyone else want to jump in? We're going to close in about another 5 minutes, but I really want to hear Sam. Did you want? Yes.
Really quickly, this is Mary. I sent
Sure.
you a follow. Please follow me back, because maybe sometime you and I can create a private room.
Absolutely.
I don't really want to open up on stage in front of a bunch of other people. It's just not anybody's business about my life. But I made it more of a broad thing with the whole trauma and stuff. But it's not anyone's, I know sometimes, like you, I like how loud you are, and I can totally talk more privately. So follow me back, and we can back channel.
Absolutely. Absolutely. And if you want to follow me anywhere else,
I'm not on any other platform.
Oh, okay. Okay. I'm out there as your healthcare BFF. And I will definitely take this offline with you. We can definitely talk more because I want to know more about your experiences and what else I can do to help women get better care. That is my focus. That is what I'm going to do as long as I can work.
Yeah, and just so you know, for Clubhouse, we can create private rooms because I don't give out my contact information to anybody.
Okay.
So we would just keep it here on Clubhouse in a private room. So if you just hit that follow, you see where my name is?
Yes.
If you click on that.
Oh, there you go.
Yep. You see where it says follow?
Yes.
Click on the follow, and there you go. And then you and I can back channel, and then we can create private rooms on Clubhouse too. Yeah, because I keep my life very private. I don't give out contact info, so Clubhouse is the best way to keep in touch with me. Totally
understood, and we will definitely do that. We will definitely do
Tiffany.
that. No problem. So I think in getting a better healthcare experience, one more time, we need to educate ourselves on our conditions, our providers, and the places we go to get care. We also have to go in prepared, ready, organized with the information we need to tell our provider in order to get the best care possible. That is the goal for every patient, especially women that are, that are patients and caregivers, or both. And I educate patients and caregivers. I focus my business totally on women that are affected by chronic illness. So I really hope that you come back next Saturday. We will, continue to talk about how women can have a better healthcare experience, just in different ways. I'm here every Saturday at 5, and we'll just take it from there. I hope I had 4 more people than last week, which is great. Hopefully the room will get bigger and we'll have more women to talk to and get experiences from. And I will be here to educate and help as much as possible. Thank you all for joining me in my room today. I hope you come back. I hope that when you get your health care, you speak up and you get the best health care possible. I'm Tiffany Matthews. I'm a board certified patient advocate, and my business is PACE, Patient Advocacy and Caregiver Empowerment. You can contact me at advocacybypace.com. Thanks again. I'm going to close out. Bye-bye. Okay, and we're going to end the stream here.